Hi everyone, and welcome back to Ask Dr. Marks Mondays. So it's a sunny day here in Chicago. The Cubs did lose last night, unfortunately, but we're still celebrating. Hopefully everybody's off to a great week. I want to focus this week on tick prevention. So unfortunately, if you've been following the popular news, there's a lot of talk about this year being the worst tick season ever recorded in United States history, which means our dogs are at risk. And I want to talk a little bit more about why that is and how we can keep your dogs safe. So the ticks out there had no problem overwintering, which means we didn't have a deep freeze for a week in Chicago in December, January, or February this year. So the ticks have been here and they're coming out, and we're already seeing a lot of disease. So I'm going to talk to you what happens if you find a tick on your dog, how can we prevent your dog from getting ticks, and a few other things that are important. So out there, when you're out enjoying the Chicago landscape, or you're out in the forest preserves or traveling with your dogs are at risk for ticks if they're around brush. So if they're on the perimeter of your backyard where there's brush, they're in the forest preserves, they're in tall grasses, anywhere where a tick can sort of brush onto your dog, into the hair coat, and then find its way to the skin. It's really challenging to find a tick on certain breeds of dogs, especially those long-haired dogs, where it's almost impossible. It's like a needle in a haystack. So that's not the best way for us to prevent your dog from getting a tick bite, from finding that tick and hopefully pulling it off before it attaches. We want to talk about preventatives. So if your dog is super active, hiking, camping, traveling with you to your summer home, going out east, we want to talk about Lyme vaccination. So call your veterinarian and ask them if that's right for your dog. There are lots of preventatives behind me, some monthly, some quarterly, that are really effective preventing from fleas and ticks. And remember, Lyme is not the only tick disease we're worried about. We're seeing Ehrlichia and Anaplasma and Rocky Mountain Spot and Fever, and these are all cousins of Lyme disease. They're bacteria that live inside of ticks that once a tick bites and attaches can transmit into your dog. We see dogs, unfortunately, sometimes positive for these tick diseases with no clinical signs. But if your dog is having joint pain, so sort of walking on eggshells, we call shifting leg lameness, limping on the front right, then limping on the back left, has a fever, lethargy, not eating, vomiting or diarrhea, we want to talk and screen for tick disease, especially if your dog has not been on preventatives or has been in those at-risk areas. If you find a tick on your dog, there's a really great, easy strategy to try and do this at home. You can use just a general flat nose tweezers, or there are lots of products out there like the Tick Tornado or the Tick Twister Pro or any of the other ones that are essentially tweezer-like. You're going to grab the base of the skin right at the tick, making sure not to squeeze or twist. Incidentally, these do say twist in the name, but we don't want to twist or squeeze. Firmly grab and pull straight out so that the entire tick is removed from your dog's body. You might see a little redness at the site. You can use a little warm soapy water and clean it and apply some triple antibiotic ointment if you're concerned. If the head does not come out when you pull that, you definitely want to talk to your veterinarian and bring your dog in, because we don't want that lingering underneath the skin. If you find a tick on your dog and that tick is attached and you remove it, we want to see your dog in 4 to 6 weeks to take a blood test and screen for any of these tick diseases. Tick diseases, again, are bacterial in nature, so we can use an antibiotic to treat them, and they are effective once we find out what's going on and, again, can determine the length of treatment. But again, prevention, always the best medicine. Let's make sure you can enjoy Chicago, enjoy spring, summer, and fall, year-round, really, with your dog outside and enjoying nature, but we want to make sure that we're keeping your dog protected. And remember, if your dog is around ticks, and you're with your dog, your family is around ticks. So this is another great way to help keep your family safe too. Happy Monday.